Good evening, Dr. Phil here. Today we will be discussing on Xenon. Introduction. Xenon is an inhalational anesthetic agent that most approaches the ideal anesthetic agent. Kindly refer to the video on sevoflurane for the characteristics of the ideal anesthetic agent. Compared with other inhalational agents or propofol anesthesia, Xenon anesthesia provides relatively more stable intraoperative blood pressure, lower heart rate, and faster emergence. However, it is associated with a higher incidence of post-op nausea vomiting. Xenon has a high cost of production of around 10 pounds per liter, therefore it is unlikely to be a mainstream drug. Cost of operation. When used in ultra-low flow systems of 0.3 liters per minute, Xenon anesthesia costs 180 to 200 pounds per hour. The radioactive isotope of Xenon is used in estimations of organ blood flow, such as during Xenon CT for assessment of cerebral blood flow and analysis of distribution of ventilation in lung perfusion ventilation scans. Physicochemical characteristics of Xenon. It is a monoatomic inert gas that makes up less than 0.00001% of air. It is a noble gas with a boiling point of negative 108 degrees Celsius. It has a blood gas partition coefficient of 0.12 and oil gas partition coefficient of 1.9. Mach 50 is 71%, metabolism is 0%. Mechanism of action of Xenon. It is an antagonist at the NMDA receptor and serotonin receptor. Xenon has high affinity glycine site NMDA receptor antagonism. There is inhibition of postsynaptic excitatory transmission. Xenon is a potent intraoperative analgesic, more potent than nitrous oxide at the spinal cord level. Antagonism at serotonin receptor means that Xenon has antiemetic actions. Xenon is an agonist at the 2-pore domain potassium channel and nicotinic acetylcholine alpha-4 beta-2 receptors. The 2-pore domain potassium channel is one of a large group of potassium ion channels. They exert influence over the resting membrane potential and cell excitability. Their regulators include oxygen, GABA, serotonin, and noradrenaline. Agonism at nicotinic acetylcholine receptors mediates spinal antinociception. Xenon has no effect on GABA-A receptors and does not stimulate the release of endogenous opioid receptor ligands. Environmental considerations. Xenon is exhaled unchanged, so returns to its source, which is the atmosphere. Therefore, it has no environmental impact in respect of greenhouse gas emissions. However, the production of Xenon is energy intensive. Pharmacodynamics. Central nervous system. Xenon can induce and maintain general anesthesia. It has a very rapid onset and offset of anesthesia, as it has the lowest blood gas partition coefficient of any inhalational agent of 0.12. Neuroprotection. Activation of glutaminergic NMDA receptors appears to be a precursor to neuronal death following hypoxic, ischemic, or traumatic cerebral insults. Xenon inhibits glutaminergic NMDA receptors. Neuroprotection from Xenon occurs at subanesthetic concentrations. There is increased cerebral blood flow, and this may increase intracranial pressure. Xenon does not uncouple the relationship between cerebral blood flow and PaCO2. Respiratory system. Xenon does not depress respiration. Minute ventilation is maintained via increased tidal volume despite decreased respiratory rate. There is increased work of breathing as Xenon is a relatively dense gas mixture. Xenon does not irritate the airways. Xenon is cardiostable and has minimal effects on the cardiovascular system even in patients with cardiovascular disease. Effects on hematopoiesis. Xenon induces increased erythropoietin production via activation of a transcription factor, HIF-1 alpha. Xenon is banned by the World Anti-Doping Agency as a performance-enhancing drug. Nausea vomiting is paradoxically more common in Xenon. Xenon has no influence on renal physiology and no effect on uterine tone. Xenon is not a trigger agent for malignant hyperparaxia, and it has no effect on hepatic blood flow. Metabolism is 0%. These are my references. Thank you.